Cardiovascular disease is the leading cause of death from smoking and the most immediate. Even low levels of exposure can trigger a heart attack or a stroke. We often link smoking with long-term conditions like cancer or chronic obstructive pulmonary disease, COPD. But the reality is, one of the most immediate consequences of smoking is cardiovascular disease. And this is not about decades of heavy smoking. Cardiovascular damage starts early. Just a few cigarettes a day or regular secondhand smoke exposure is enough to increase the risk of a heart attack. So let's walk through the major cardiovascular effects. First, endothelial dysfunction. The endothelium is the inner lining of blood vessels. It plays a critical role in maintaining vascular tone and keeping vessels dilated and flexible. Smoking damages the endothelium, reducing nitric oxide availability, which impairs vasodilation. The result? Stiffer arteries, higher blood pressure, and a greater chance of plaque rupture. Second, inflammation. Cigarette smoke triggers systemic inflammation. Levels of pro-inflammatory cytokines rise, including interleukin-6 and tumor necrosis factor alpha. These chemicals contribute to atherosclerotic plaque formation and instability. CRP levels also increase with smoking, making it a helpful marker to track systemic inflammation related to cardiovascular risk. Third, thrombosis. Smoking increases platelet activation and aggregation. It also disrupts the balance between prothrombotic and fibrinolytic factors. That means clots form more easily and are less likely to dissolve. This hypercoagulable state is a key driver of acute coronary events, including myocardial infarction and stroke. Fourth, lipid abnormalities. Smoking decreases HDL cholesterol and increases LDL oxidation. Oxidized LDL is particularly damaging as it promotes foam cell formation in arterial plaques. Together, these changes accelerate atherosclerosis and make plaques more prone to rupture. And then there's carbon monoxide. When carbon monoxide binds to hemoglobin, it reduces the oxygen-carrying capacity of blood. Tissues receive less oxygen, even when perfusion appears to be adequate. The heart responds by working harder, increasing oxygen demand at the same time as oxygen delivery is impaired. This mismatch increases the risk of ischemia, arrhythmias, and sudden cardiac death. Now, what kinds of cardiovascular diseases are we talking about? Well, firstly, coronary heart disease. Smoking is a major independent risk factor. Even low-intensity smoking, like 1 to 4 cigarettes a day, significantly increases this risk. 2. Stroke. Both ischemic and hemorrhagic stroke risks increase. Smoking accelerates atherosclerosis in cerebral vessels and contributes to aneurysm formation. 3. Aortic aneurysm. Smoking weakens the aortic wall, increasing the risk of abdominal aortic aneurysm, particularly in men. 4. Peripheral artery disease. Smokers are up to 4 times more likely to develop peripheral artery disease. Symptoms often appear as intermittent claudication. 5. Sudden cardiac death. Smokers have an increased risk of fatal arrhythmias, especially in the presence of existing heart disease. And 6. Heart failure, not always directly caused by smoking, but it's more likely to occur and progress faster in smokers, partly due to microvascular dysfunction. So let's pause on one striking statistic. Up to 30% of all coronary heart disease deaths in the US are attributable to smoking. And these effects are not limited to active smokers. Secondhand smoke exposure can cause endothelial dysfunction within minutes. It increases platelet activation, reduces vascular compliance, and elevates heart rate. Just 30 minutes in a smoky room can impair coronary blood flow. For non-smokers living with a smoker, the risk of coronary events increases by 25 to 30%. Children exposed to secondhand smoke also show early signs of vascular dysfunction, elevated CRP, increased carotid intima media thickness, and higher blood pressure. So how does this affect clinical care? Well, first of all, start by recognizing that cardiovascular risk rises rapidly with smoking and falls rapidly with cessation. Within 24 hours of quitting, the risk of a heart attack already starts to drop. Within a year, it's halved. After 5 to 15 years, risk can return close to that of a never smoker depending on age and comorbidities. That's a powerful motivator. Most people want fast results, and cardiovascular health is one area where quitting delivers quickly. Now let's talk about smoking in the context of diabetes. Smokers with diabetes have a significantly higher risk of myocardial infarction and stroke compared to non-smoking diabetics. Smoking worsens insulin resistance and contributes to poor glycemic control. It also accelerates microvascular complications. And in people with hypertension, smoking compounds vascular injury and increases the difficulty of controlling blood pressure. Smoking also interacts with medications. It induces CYP1A2 enzymes affecting drugs like clopidogrel and warfarin. Both of these drugs are important for cardiovascular health. It decreases the effectiveness of beta blockers. It alters statin metabolism, which can affect lipid control. From a public health perspective, this is one of the best examples of a modifiable risk factor. In terms of cost, burden, and lives saved, helping people quit smoking is more impactful than managing cholesterol or prescribing antihypertensives. And don't forget pregnancy. Smoking during pregnancy increases the risk of preeclampsia and placental abruption, both of which are cardiovascular in nature. It also programs the fetus for long-term cardiometabolic risk by affecting vascular development in utero. So what do we do with all of this? Firstly, prioritize smoking cessation as a cardiovascular prevention. Don't wait for the 30-pack year history. Every cigarette matters. Second, include secondhand smoke exposure in your cardiovascular risk assessments. Ask patients about their home and work environments. Thirdly, frame smoking as a vascular poison, not just a habit. Use language like "your arteries are under attack" to personalize the risk. Fourth, encourage routine cardiovascular monitoring in smokers, lipids, CRP, blood pressure, and ECGs if needed. And finally, remember that a brief intervention does work. A simple, clear message like "quitting today cuts your heart attack risk in half within a year" can make a real impact. Smoking is a systemic, vascular assault, but the silver lining is this: once you stop, the healing starts almost immediately. In our next episode in this smoking series, Smoking and Pulmonary Disease, a Slow Suffocation. That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.